John Snow was an English physician in the mid-1800s who is considered to have contributed greatly to the development of anesthesia and medical hygiene. He is also considered to be one of the fathers of modern epidemiology.
John Snow accomplished many big things in his lifetime. He was one of the first people to study and calculate dosage for the use of ether and chloroform as surgical anesthetics. He was a leader in the development of anesthesia and medical hygiene. Throughout his time of working with anesthetics, he designed the apparatus to safely administer ether to patients and designed a mask to administer chloroform. He also published an article on ether in 1847 titled "On the Inhalation of the Vapor of Ether." In 1858, he published a longer version titled "On Chloroform and Other Anesthetics and Their Action and Administration." He would also use these anesthetics to help with childbirth. He actually used these anesthetic techniques to help with the birth of Queen Victoria's children. Besides anesthetics, he was also big on public health. He published an article titled "On the Mode of Communication of Cholera" in 1849. He published this after there was a cholera epidemic, and he determined that the problem wasn't airborne like people thought it was. He proved that the source was actually a public water pump, and once the pump was removed, the issue started to decrease. There is no exact reason for saying why he was interested in these topics, but growing up, Snow experienced contamination and unsanitary conditions in his hometown. The river near his house was contaminated by runoff water from the unsanitary streets. This could have been why he knew the cholera was from water and not airborne. He also was a surgeon apothecary apprentice and helped out in a cholera epidemic when he was only a teenager. Having these experiences might have impacted what areas he was interested in. Although, for anesthetics, he did use ether to promote respiration so that he could use certain chemicals in his lab.
In regard to cholera, John Snow discovered that the deadly disease was spread through people drinking water that was contaminated by sewage, while other physicians at the time were convinced that the disease was airborne. When the outbreak came close to his home, Snow used a geographical grid to chart the deaths from the outbreak by location, and then he individually investigated each case to see where the victim was receiving their water supply from. Through his research, he discovered that all who had died from cholera were drinking water from the same pump supply. He also found and interviewed individuals in the same area who had not contracted cholera and asked where they had got their water supply in order to rule out other possible sources of the epidemic. In regard to experimenting in anesthetics, John Snow administered controlled doses of ether and chloroform to animals and volunteering patients that were going into surgeries or child labor. He made anesthetic drugs safer and more effective by experimenting with the threshold of what could have been potentially dangerous to patients.
Jonathan Snow's legacy is extensive. His studies of dosages and safe administration of anesthesia led to medical and religious acceptance of obstetrical anesthesia. His discount of the miasma theory, or bad air theory, to explain the spread of diseases like cholera and bubonic plague drastically changed the way scientists view disease transmission. He established that the disease was waterborne, which prevented further outbreak of cholera, and he proved this by showing that a certain waterworks company in England was taking water from sewage-polluted sections of the River Thames and delivering the water to homes, which led to a rise in cholera outbreak. This study is regarded as the founding event of the science of epidemiology. This event in science is still commemorated today at the Pump Handle Lecture, an annual event in England, and at this event, members of the John Snow Society annually remove and replace a pump handle to symbolize the water pump that brought infected water into households during the 19th century. This symbolic action shows the continuing challenges for advances in public health. To further honor his legacy, the Association of Anaesthetists of Great Britain and Ireland awards the John Snow Award, a bursary for undergraduate medical students undertaking research in the field of anesthesiology. Thanks to Jonathan Snow, surgeons who wished to anesthetize their patients no longer risked harming them by the unscientific application of chloroform-soaked handkerchiefs to their faces. His lasting legacy can be seen by the improvement in the fields of anesthesiology, epidemiology, and obstetrics.